Welcome to Heart Month. I'm Teresa Dark with Marketing and Communications, and today with me I have Dr. Usman Khokhar, an interventional cardiologist. Welcome.
Teresa, thanks for having me.
So can you tell me what structural heart disease is?
Sure. So Teresa, structural heart disease is basically disease of the structure of the heart, which includes, for example, valves. Any disorder of the valves of the heart would fall into the category of structural heart disease. And similarly, any disorder of the walls of the heart. So for example, if somebody has a hole in the heart, would be included in the structural heart disease category.
So we have this new procedure that we're doing here called TAVR. Can you tell me what that is and why we would use that?
Sure, I think that's a great question. So TAVR is short for a procedure called transcatheter aortic valve replacement. This is essentially a procedure where we replace one of the valves of the heart with a new valve, but without opening up the chest. So the aortic valve is the main outflow valve of the heart. This is one of the structures that allows blood to go from the heart to the rest of the body. With age and with because of certain other issues, sometimes there is degeneration of the heart valve, which causes the heart valve to narrow. Now the heart has to pump against a very narrow orifice, which means demand on the heart muscle is increased, and patients start having symptoms such as chest pain or shortness of breath, lightheadedness or dizziness, and sometimes even start passing out. Unfortunately, if this problem is not fixed, it carries a 5-year survival, which is quite low, and therefore fixing it is very, very important. Traditionally, we fix this problem by opening up the chest. The surgeons would replace the heart valve with a new valve. But with the development of catheter-based techniques, we can now replace this heart valve by going through the groin, much like a traditional heart catheterization, and putting a valve inside the old one without having to open up the chest or subjecting the patient to major heart surgery.
Wow, that is really amazing, a wonderful advanced technology. And I know we're doing some other minimally invasive procedures here. Can you just list a couple of them and let us know?
Sure. Sure. Another one of the very important procedures we're doing is called a PFO-ASD closure procedure, where some patients are born with holes in the heart, and these holes in the heart can cause heart failure or contribute to strokes. We have certain devices that we can place across these holes. These devices basically are made of 2 discs, and each disc lies on either side of the hole and basically closes it off. And once again, this procedure can also be done through groin access without the need to open up the chest. So once again, a minimally invasive procedure. Another important procedure that we do here is basically sealing off a cavity in the upper chambers of the heart with the device, once again placed through the groin. The importance of that is that in some patients who have arrhythmias like atrial fibrillation, they are prone to strokes because of stagnation of blood in these cavities or recesses. These patients who are not candidates for blood thinners because they're either prohibitive risk or high risk for bleeding, we place these devices, and we mitigate the risk of stroke, and the patients do not need to be on blood thinners anymore. This device is called a Watchman device, and we have started doing this at Allegiance a few years ago.
That's just amazing. What wonderful technology that we have here to help everybody. Thank you, Dr. Khokhar, for coming and helping us explain what techniques we have and the great things that we do here at Allegiance.
Thank you very much for having me.